let's still stay with health, but this time to another issue, the coronavirus. And we know it is widespread, and the World Health Organization has described it as an international emergency. Here in Ghana, the Ridge Hospital is one of the referral centers, and we will speak to the director here to actually walk us through what plans they have in place for this particular virus in case Ghana actually records any of such incidents. Thanks so much for joining us on the Citi.
Thank you too for coming.
So if you could walk us through this facility that you have here. We know this has been set up to actually contain or take care of the virus in case it happens to Ghana. If you could walk us through this facility that has been set up for this particular purpose.
Thank you so much for coming. So as you can see, this is the Greater Accra Regional Hospital Infectious Disease Isolation Center. So really not meant for only this particular virus, but any seriously infectious condition can be brought here. For now, our concern is the coronavirus. So as you can see, the place is purposely designed for that purpose. We have an entrance area solely for the nurses. Patients who are confirmed will not use the same entrances as the nurses. So when the nurse arrives, this is the nurses station. The place is so designed and furbished in such a way that when the nurse arrives, the nurse will have to sanitize her hand as it arrives from home, and the device is there on the ward. There will be documents and ledgers. The nurse herself will check herself and make sure she's fine, because if the nurse is not well, we will not allow such a person to work in a unit like this. And when all is done and the nurse wants to provide service, there is another room where the nurse will go and change into the appropriate personal protective gears.
Okay, so if you can walk through
yes.
to...
So this is the room that is designated for that purpose. This is where the nurse will change from her uniform, from her regular uniform, into the protective gears before she gets to the patient. So the barrier will be here. Once the nurse is well dressed, her logistics are there, he moves them across here in order to don appropriate attires. And once that is done, he moves into the patient's room, the particular patient for whom she wants to provide the service. She moves into the patient's room and then attends to the patient. And after attending to the patient, maybe she wants to give medications or give an infusion to the patient. When that is done, the nurse will then move along the corridor to the last open area where she will remove the gowns and get them sterilized again. And then she also has a washing base there where she can wash her hand and sterilize her hands again before she comes back to her station. So that is the design of the place.
So this is one of the rooms for the patients. So we have the bed here. We have a trash box. Yeah.
Yes, we have a trash board. As you can see, it's an infectious material, so that is why we have the yellow. The yellow trash boxes is where we put infectious materials in, and it's a self-contained unit. So the patient who, if a confirmed case, will have her own or his own washroom, a bath area, and a hand washing base. So as you can rightly see, then he also have a device where she can, he or she, from time to time, will sanitize her hand or his hand.
Okay, so if the person has gone through all the processes and is cleared, what will be the processes to get the person out of this place again?
What do you mean by is cleared? Let's say...
Okay, so the disease is healed, yes.
Yes. So we are still waiting for national team to give us some of the protocols. But once the patient is confirmed healed or cured, then the patient himself or herself, together with the family members, will now have to be counseled. We have put again together a team of clinical psychologists who will now take the patient through a counseling and the family members as to how to live with the patient until complete and total recovery.
Okay, so we know there's a treatment center.
Yes.
Do you have plans of a holding area?
Yes. So initially, this place can serve both as holding and a holding center, but immediately we confirm a case and the confirmed case is here, we will no longer use this place as a holding center. We have created another place which is waiting. Then this place will solely be for treatment. And then the holding center will be at another place. So when the holding center will be a place where suspected cases are held. And then the samples are taken and sent to Noguchi. We are told that the turnaround time will be up to about 10 hours, but we are giving ourselves up to about 24 hours. So within the 24 hours, once we get the patient's results, it will be one of two, not confirmed or confirmed. Confirmed cases would then be moved to this treatment center, and non-confirmed cases can then be discharged to be united to their family members.
All right, thank you so much for speaking to us.
Thank you.
So this is still the Citi newsroom, and this is one of the rooms, as you can see. So we have actually a sanitizer here. This is what the patient will be using. The bed is here. So no two patients can share a room. It is one patient or a patient to a room, so that the nurses can actually monitor and take care of the person. This is still the Citi newsroom.